Have you ever wondered why you're constantly running to the bathroom, even when you haven't been drinking excessive fluids? Could this be a sign of diabetes? Welcome to our deep dive into the world of diabetes, a condition that affects millions worldwide. We're going to explore some common, yet often overlooked warning signs. These indicators might just be your body's way of signaling that something is not quite right, so let's not waste any more time. Let's dive deep into the warning signs that you might have diabetes. Frequent urination and increased thirst. These two symptoms, though they may appear unrelated, are closely entwined. The key factor here is an excess of glucose in your bloodstream, known as hyperglycemia, leading to frequent urination or polyuria. The body, striving for balance, pushes the excess glucose into the urine. This process draws more water into your urine, causing more frequent trips to the restroom. This then leads to dehydration, and, subsequently, increased thirst or polydipsia. The body's cry for hydration might seem like a simple call for more water, but it's more complex. These symptoms could indicate an underlying health issue, such as diabetes, especially when the kidneys are unable to filter and absorb the excess glucose. So if you're experiencing persistent thirst and frequent urination, it's essential to consult a medical professional. These symptoms may seem mild, but can be early warnings of diabetes. Moving on, have you been losing weight without trying and feeling tired all the time? It might seem like a dream come true to shed some pounds without hitting the gym, but it could be a sign that your body isn't functioning as it should. Let's delve a bit deeper into this. In the case of type 2 diabetes, your body may resist the effects of insulin, or not produce enough of it to maintain normal glucose levels. Now, glucose is like the fuel for your body. It's the main source of energy that keeps you going, but when there's not enough insulin, your body can't use this glucose for energy. So, what does it do? It starts looking for alternative sources of energy and begins burning fat and muscle. While this might lead to weight loss, it's not the healthy kind you want. But that's not all. This inability to use glucose for energy also has another side effect: fatigue. You see, when glucose can't enter your cells effectively, it results in an energy shortage. It's like trying to run a car without fuel. This can leave you feeling constantly tired no matter how much rest you get. You might find it hard to concentrate, feel weak, or even have trouble staying awake during the day. Now, let's talk about blurred vision and slow healing of wounds. Blurred vision is one of those symptoms that can be easily overlooked. But did you know, high blood sugar levels can actually cause the lens in your eyes to swell? This change in shape of the lens can distort your vision, making things look fuzzy or out of focus. Imagine trying to view the world through a foggy window. That's how it can feel. Over time, if diabetes is left unchecked, the damage to the blood vessels in the retina can lead to diabetic retinopathy, a condition that can result in vision loss. Now, you might be thinking, okay, blurred vision is one thing, but what's the deal with slow healing of wounds? Well, it's all connected. Elevated blood sugar levels can impair circulation and damage blood vessels. This slows down the delivery of oxygen and nutrients to tissues. Imagine a bustling city where traffic is smooth and efficient. Now picture a scenario where there are constant roadworks and detours, slowing down the delivery of goods. That's what happens in your body when blood sugar levels are high. The goods, or nutrients and oxygen, can't reach their intended destinations or tissues promptly. This in turn delays wound healing. Moreover, this sluggish healing process increases the risk of infection. A small cut or blister may seem insignificant, but for someone with uncontrolled diabetes, it could lead to more serious complications. So, if you're noticing changes in your vision or if your wounds are taking longer than usual to heal, it might be worth discussing these symptoms with your healthcare provider. Finally, we will look into numbness or tingling in hands and feet, frequent infections, increased hunger, and darkened skin patches. Prolonged high blood sugar levels can wreak havoc on our nerves, leading to a condition known as neuropathy. This can result in a feeling of numbness, tingling, or even pain, especially in the hands and feet. It's like a warning bell, telling us that something is going wrong in our body. Now let's talk about infections. High blood sugar levels can weaken our immune system's ability to fight off infections. This makes us more susceptible to bacterial and fungal infections. It's not just the common cold or flu that we need to be wary of, but also skin infections, urinary tract infections, and even gum disease. So if you find yourself falling ill more often than usual, it might be a sign of elevated blood sugar levels. Next up is increased hunger, also known as polyphagia. Despite having high blood sugar levels, the body's cells can become starved of glucose. This is due to insulin resistance or deficiency, where the body either resists the effects of insulin or doesn't produce enough of it. This triggers hunger signals, leading to increased food intake. It's like your body is constantly asking for more fuel, even when there's plenty in the tank. Darkened skin patches, a condition known as acanthosis nigricans. This is caused by insulin resistance, which can lead to excess insulin production. Excess insulin stimulates the growth of skin cells and increases melanin production, resulting in dark, velvety skin patches, usually in the neck or armpit areas. In this journey, we have comprehended the 10 critical signs that might indicate diabetes, all of which can be associated with prolonged high blood sugar levels and insulin resistance. These signs are your body's way of calling for attention. It's crucial to listen to these signals and seek medical advice if you experience them. Ignoring these signs could lead to severe health complications. However, early detection and treatment can manage the condition effectively, helping you lead a healthier life. Remember, early detection can make a significant difference. If you found this video helpful, please like, share, and subscribe for more health-related content.